Assalamu alaikum. I am Dr. Mir Moyeedul, Associate Professor of Pharmacology, Sakina Women's Medical College, Jashore. In today's session, we will discuss about anti-diabetic drug, and our topic of discussion is about insulin. Insulin is an anabolic hormone that is released from the pancreatic beta cell and which is given for controlling of type 1 diabetes mellitus and type 2 diabetes mellitus when oral anti-diabetic drug is failed to control the chronic hyperglycemia. Insulin is a polypeptide which is composed of 51 amino acid and composed of two chain, one is B chain and A chain, and it is interlinked by a disulfide linkage, and its molecular weight is 5808. Insulin is so much important for our metabolism and to control our blood sugar level. Insulin is a immense gift of our creature, because it is the only hormone that control our blood sugar level, and in our body all the other hormones which increase our blood sugar level, and it is the only hormone that decrease our blood sugar level and control our blood sugar level. So, before going to insulin, we have to discuss why insulin is important in controlling of diabetes mellitus. Why insulin is necessary nowadays? What is the indications of insulin? Insulin is indicated in type 1 diabetes mellitus. It is indicated in type 2 diabetes mellitus when oral anti-diabetic agent are failed to control the chronic hyperglycemia. Insulin is used in diabetes mellitus with different type of surgery in perioperative, postoperative and preoperative period. Insulin is also necessary to control the gestational diabetes mellitus. Not only the diabetes mellitus, but also electrolyte imbalance. Insulin controls a electrolyte imbalance situation that is called hyperkalemia, because insulin increase the intake of potassium into the cell of our body, and it takes the blood potassium into the cell and makes the blood potassium into normal level. So, in case of hyperkalemia is another indications of insulin. These are the important indications of insulin in the professional examination. In our everyday situation, insulin is so much necessary. So, we have to know why insulin is necessary for us, and this is the important indications of insulin. Before going to insulin, we have to we first discuss about the pancreas. The pancreas is an important mixture of gland. It is a composed of exocrine and endocrine part. The exocrine function of the pancreas is related with the digestive enzyme and also related with the bicarbonate secretion, and it secretes from the acinar cell to the pancreatic duct, and this duct release their digestive enzyme and also the bicarbonate into the second part of the duodenum. This secretion does not goes into the blood. The endocrine portion is composed of cluster of cells which is called the islets of Langerhans cell, and in which one of the cell is beta cell that release the insulin. Not only release the insulin, beta cell release the proinsulin and also the connecting peptide and also an important hormone that is amylin. So, now this is the picture of the pancreas. Pancreas is a double gland. It is a mixture of exocrine and endocrine gland. The exocrine function is pancreas is 99% the functioning pancreas as an exocrine gland, and the endocrine gland it acts as only 1%. This is the exocrine portion of the pancreas, and this is the endocrine part. Endocrine part mostly composed of cluster of cell that is called the islets of Langerhans cell. This is the islets of Langerhans cell, and this is the exocrine part of the pancreas, which is composed of acinar cell. Through the acini and through the pancreatic duct, it releases into the second part of the duodenum. It secretes the digestive enzymes and also the bicarbonate. From the inner of the cell, it secretes the bicarbonate, and from the inside of the cell, it secretes the digestive enzyme, which is released through the pancreatic duct. This is the pancreatic duct, and it releases these contents into the second part of the duodenum. So, this is the important function of the exocrine part of the pancreas, but our discussion is totally dependent on endocrine part. This endocrine part is composed of cluster of cell. This is the cluster of cell which is scattered throughout the pancreas, and this is called the islets of Langerhans cell. These islets of Langerhans cell composed of 4 types of cell, that is the alpha cell, that is the beta cell, that is the delta cell, and another cell that is called pancreatic polypeptide. These islets of Langerhans mainly presents into the tail of the pancreas. Excess of islets of Langerhans cell presence in the tail of the pancreas, but it throughout the pancreas. The important cell that is released from the islets of Langerhans cell, one is alpha cell. Alpha cell presents in the periphery and it secretes the glucagon. The function of glucagon in starvation, in fasting, it causes glycogenolysis and causes the gluconeogenesis and maintain our blood sugar level when blood sugar level is less in certain situation. The another cell is beta cell. Beta is a beautiful lady that is present in the cluster of the cell or in the middle part of the cell. These cells are release the insulin, connecting peptide, proinsulin and amylin. There is another cell that is delta cell which is scattered throughout the periphery. This is the peripheral delta cell and this is the inner delta cell, and they release this delta cell release the somatostatin, which is a universal inhibitor. And there is another cell that is called pancreatic polypeptide which secretes the pancreatic polypeptide. This alpha cell, another name of alpha cell is A cell, another name of beta cell is B cell, another name of delta cell is D cell, and another name of the PP cell is F cell. So, these are the important cell that are released from the islets of Langerhans, and from these the beta cell mass, the secretion of insulin, which is the today's topic session. So, this is the insulin, and the insulin is released from the pancreatic beta cell. Now, we going through the structure of the insulin. So, this is the Prepro Insulin, which is composed of 110 amino acid. This Prepro Insulin is composed of 110 amino acid, and it is composed of an initial segment which is produced or which is composed of many different types of amino acid. It is called the initial segment. Another name of initial segment is signal sequence. So, this is the B chain which is composed of some amino acids, and they are connecting with the A chain. This is the A chain which is composed of some types of amino acid, and this is connecting with the C peptide. This is the Prepro Insulin, and this is the first precursor of insulin. This Prepro Insulin is become proinsulin by cutting of the initial sequence or initial segment or signal sequence. It becomes the proinsulin. This is the proinsulin. So, by cutting the initial segment, this structure is formed, and it is called the proinsulin, in which there is B chain, there is A chain and C peptide, but they are interlinked when with the disulfide linkage. Through interlinked or intralinked, it is produced the proinsulin. In human, the proinsulin amino acid is 86 amino acids. This proinsulin then converted into insulin and C peptide by cutting the C peptide out from the proinsulin, and it becomes insulin and C peptide. So, this is the structure of the insulin. Insulin is composed of 51 amino acid. There is 51 amino acid. The B chain contains 30 amino acid and A chain contains 21 amino acids, and they are interlinked through by disulfide linkage. Through disulfide linkage, they interlink the B chain and A chain, and they are intralinked between them. This disulfide linkage not only complete a bridge between the B chain and A chain, they also form a bridge between themselves. So, this is the insulin, and this is the structure of the insulin, and this is the important thing that is also released from the proinsulin, that is the important C peptide or connecting peptide. So, this is the important structure of the insulin. So, now we will discuss about how insulin is synthesized. So, insulin is synthesized from the ribosome of rough endoplasmic reticulum. When the ribosome binds with the endoplasmic reticulum, it forms the rough endoplasmic reticulum. From this, the insulin is synthesized. The DNA sequence of insulin remains in the chromosome number 11, and from the chromosome number 11, the DNA sequence starts to from the mRNA into the cytoplasm. In the mRNA, from the mRNA, by through the translation, they produce the protein synthesis. When this protein are synthesized from the ribosome, this ribosome binds with the endoplasmic reticulum to form it rough endoplasmic reticulum, in which the chain is synthesized, and when the chain is synthesized mode or protein synthesized mode, then it becomes the insulin, and the insulin is processed and packaged into the Golgi apparatus and is stored into the secretory granules. This is the picture of pancreatic beta cell in which the insulin is synthesized. Insulin is present into the insulin gene or the DNA sequence of the insulin present into the chromosome number of 11 into the nucleus of this cell. This is the nucleus of this cell, and this is the chromosome, and this is the short arm of the chromosome, and this is the long arm. And in the short arm of the chromosome, the insulin gene is present, and this is the DNA sequence of the insulin. This DNA sequence of insulin then form mRNA into the cytoplasm by transcription. Through translation, they produce the protein, and this protein is synthesized from the ribosome. This is the ribosomes. When the ribosome binds with the endoplasmic reticulum, this is the endoplasmic reticulum, it forms the rough endoplasmic reticulum. This rough endoplasmic reticulum, the DNA, the protein is synthesized into it, and the chain is become elongated. When the chain becomes elongated, and it produces the insulin. Insulin is a polypeptide that is composed of 51 amino acid. Now, insulin is synthesized into the rough endoplasmic reticulum, then it enters into the Golgi complex. This is the Golgi complex. When the insulin is processed and packaged into the Golgi complex, and there is another thing that binds with the Golgi complex, that is the secretory granules. This is the secretory granules in which the insulin is stored. Insulin is stored with zinc molecule. 8 milligram of insulin bind with the 2 milligram of zinc molecule. This is the synthesis, packaging, processing, and the storage of the insulin. Now, our pancreas contains 1 to 2 million of islets. So, there is 10 to 20 lakh of islets of Langerhans present in our body. In this 20 lakhs or 2 million or 1 to 2 million of islets of Langerhans, there is abundant of beta cell. There is 75% of beta cell present in the islets of Langerhans, from which the insulin is released, and our body contain or the beta cell contained 8 milligram of insulin, that is equal to 200 international unit, from which only 25% of insulin is secreted daily, that is only 30 to 40% 30 to 40 international unit of insulin is secreted daily. So, this is the storage and the content and the release, how much insulin is released. Today's session is end by learning this thing. So, hope we will discuss the next class on regulation of insulin and how insulin is released and what are the factors that regulate the insulin. So, thank you all for listening this, and hope you will enjoy the next class.